This is a case of a patient that we had put a plasty. We had done a PTCA and stenting to the LED for acute anterior wall MI. That was about 4 years ago. We implanted a drug-eluting stent, and you can see here very clearly where the drug-eluting stent was implanted. So this is the area where the drug-eluting stent has been implanted. So this implantation was done about 4.5 years back, and as you can see that the stent is working perfectly. This is the iliacaudal spider view, and again in the epicranial view we can see that the stent is working perfectly even after 4.5 years. Just see that there has been no plaque. We've kept the LDL under control, and this is just a perfectly put stent even after 4.5 years. But the problem is after 4.5 years the patient has developed a lesion in the mid RCA that is causing her problems. We actually did an angio. We thought that the stent might have been occluded, but the stent was working very perfectly. But there's a new lesion in the RCA. The stent was not put here. The stent was put in the LED about 4.5 years ago, which is working very well. The stent is patent, but the new lesion is here, so we've decided to put a stent here in the RCA, in the mid RCA. So we wired the RCA. We used a BMW wire, PTCA wire, 0.014 inch, and we're doing a direct stenting here. It is very important to note that we're doing all this via the right radial artery route, and 4.5 years ago also we did the angioplasty by the right radial artery route, and she's a female patient. And the importance of a good procedure or clean procedure, and using the good technique where you're not working against resistance is very important, because we want to preserve the radial artery as much as possible so that future interventions can also be done, like in this case in the patient. So yeah, you can see the right radial artery. This is the JR 3.5, and we're using a stent, and stent placement is being done. The stent is being inflated. Good inflation has been achieved. Now after the inflation, the artery is opened up quite well. Using a live stent thing, there's the post dilatation. See some more post dilatation. So we believe that aggressive post dilatation and matching the artery to the vessel is very important. We also took a small IVUS run, and we could see good stent opposition. I'll have to see whether the IVUS is sit down right now, otherwise I'll post a different video about it. And wonderful way it has been opened, and you can see good result throughout. And yeah, so hopefully for the next 5 to 10 years the stent is also going to work, and maybe even more than that, hopefully.